Hello, everyone, and welcome to the April 20th, 2022 All In for Kansas Kids biweekly webinar. I am Debbie Deer, and I'm also joined today by Hannah McGahey and Megan Broha, and we all work for the Kansas Children's Cabinet and Trust Fund and are happy to be here together with you today to bring you this webinar and definitely appreciate you spending your time with us. So for today's agenda, we are going to do our general updates that we always try to keep you updated on for things that are currently available to you and the children and families that you serve throughout your networks. And then we will be joined by Emily McGinley from Child Care Aware to present information about their Child Care Health Consultant Network. And I will let you know that we will probably be having a little bit shorter of a webinar today, so you might be able to get some time back in your day after our general program takes place. So to start us on our updates, a reminder that April is continuing to be Child Abuse Prevention Month. And you might see the blue pinwheels around everywhere in your communities this month as a symbol to represent this. Kansas Children's Service League is the state chapter for Prevent Child Abuse America and leads the charge in organizing this campaign every year along with providing resources. So Megan is putting links in the chat, and one of those will take you to the 2022 Child Abuse Prevention Month Toolkit, which is 29 pages of templates and talking points, calendar events, media and marketing materials, and social media information, fun craft projects, etc. And also an order form for you to access the materials and resources that are available to include the pinwheels if you want to order some of those. You can also contact Pam Noble at KCSL by email or phone for more information. We also continue to share information out with you on round 3 of the sustainability grants for childcare providers that opened on March 1st. This is available through a partnership with KDHE and Child Care Aware. And applications are being accepted through November 30th with an eligibility of up to 14 months of payments available. So you can find this link in the chat. And this is a great opportunity to benefit and enhance the important work that all of you are doing to provide care for children in Kansas. And participating in this could hopefully make that process much easier for you. We want to announce the upcoming Kansas Association for Infant and Early Childhood Mental Health annual conference that is scheduled for April 28th and 29th, so coming up soon. So please go to the links provided to learn more about registering for this opportunity. There is also an opportunity available for you to take the All In for Kansas Kids provider and staff survey. It's a short survey that will only take a few minutes of your time. We want to hear about your expertise in providing services and working in the early childhood field across the state. Your responses will help us to explore the workforce, to get information on financial and retirement planning, how to expand capacity in providing services to families, which, as we all know, is very vital to the future of families and children, businesses, and employers in Kansas. So all participants will have the option to enter into a drawing to win a $100 Walmart gift card. Mental health and first aid training is being offered through the United Methodist Health Ministry Fund as part of their work. And the Governor's Commission on Racial Equity and Justice included this training in 2 of its behavioral health recommendations. And so these training sessions are offered at no cost. Space is limited, so you'll want to register for these. And we hope that you can find those in the chat. I know that you can find those in the chat, and the sessions are listed here and are scheduled through May 19th. A virtual town hall is taking place for childcare providers, and it's being co-sponsored by DCF and the Child Care Providers Coalition, or CCPC. This is happening on the evening of April 21st at 6:30. So you'll want to get this saved on your calendars. It's coming up tomorrow. This event will facilitate a conversation with providers on ways that these two sponsoring groups are supporting you in caring for children during the ongoing challenges of the pandemic. So please register soon. If you are a caregiver of a child in Southeast Kansas, or you have lived experience with child and family services and you want to help your community, you can join the Family Strong Steering Committee. So the Family Strong Grant Project is looking for family representatives to serve on this committee. And this is a federally funded grant led by the University of Kansas School of Social Welfare and Center for Public Partnerships and Research. Family Strong is designed to transform the child and family service system in Southeast Kansas. And the intention is to provide all families in that area with a vast array of services to meet their needs, as to avoid crisis escalation and subsequent involvement with child protective services. And so stipends for participation will be provided. And to find out more about this project, the steering committee, and how you can be involved, please email Dr. Kayla Byers at the email listed here, or you can visit the committee member application page. A live webinar is being offered by the United Methodist Health Ministry Fund on April 26th from noon to 1. The topic of this webinar is navigating vaccine hesitancy for families. And so childhood vaccination is a sensitive topic, whether you're discussing wellness vaccines or COVID-19 vaccines, and it's important to meet people with empathy and active listening. And so this webinar is intended for an audience with childcare and early learning providers, as well as healthcare providers, to help families better understand this topic. And so a recording will be available at healthfund.org if you want to go to that afterwards, or you can access information at the link being provided on how to attend live. NACCE and BUILD initiative are featuring learning opportunities at their annual conferences with various workshops that are listed here. And so BUILD 2022 Smart Start Conference will be held virtually on May 2nd through 5th. And NACCE Professional Learning Institute will be in Cleveland, Ohio on June 12th through 15th. And so please note the links in the chat for more information on both of these, and the workshops that are included are listed here. The Lawrence Kindergarten Transitions team is hosting an upcoming Early Childhood Family Resource Fair at their Kennedy Early Childhood Center this Saturday, April 30th from 9 to noon. And please note the date change due to the activities that happened around the KU basketball team's national championship parade weekend on April 9th. That was a previous date that had been set. So this is a new date that they've rescheduled to. And this is a family-friendly event with over 40 local organizations that will be in attendance. And there's going to be a lot of fun and interactive activities for the kids, as well as informative resources and support for parents and caregivers to help prepare for a successful transition into kindergarten. So this is definitely an exciting opportunity if you live in the Lawrence area or know someone who does, that you can share this information with. You can go to the email listed here for more information. This sounds like a very fun event. And speaking of kindergarten transitions, it is that time of year again when most school districts are holding their kindergarten roundup events, and KSDE has the Kindergarten in Kansas booklet available for families. And this can be used as a reference by families and caregivers for, again, a successful transition from early child to kindergarten, and all of the information that you might want to know for that. This booklet is available for distribution free in multiple languages. And so you can go to the link in the chat to access this resource online or to request copies to share throughout your networks. The 2022-23 Early Childhood Recommendations Panel membership applications are being accepted now through May 1st. And so any interested Kansan listening in today or anywhere out there may apply, as well as any current panel members who are interested in reapplying to serve another term. And so all applications will be reviewed and a slate of candidates will be recommended for consideration and approval by the Children's Cabinet at their June 3rd meeting. And the approved applicants will be immediately notified, and then their terms will begin on July 1 and extend through June 30th of 2023. And so we currently have 40 panel members, which was the same as year one. So that seems to be a manageable number. So we anticipate that that will be similar to what we will plan to move forward with into year 3. That will, of course, be determined as the process continues and applications are reviewed. We do need to have a representation from all of the groups that are identified in the executive order, which establishes the recommendations panel. And that includes state agencies of DCF, KDHE, and KSDE, Head Start representatives, providers and organizations providing early childhood services in Kansas, family members with children who are receiving services in Kansas, representatives from both local school districts and higher education institutions. And then there is another category, which with various individuals who serve in some capacity as early childhood stakeholders throughout the state. And so if you pull the application up at this link that's listed here, it's a very simple application and you can check the box for whichever one of those groups that you might be representing if you were to apply. So you're more than welcome to contact me with any questions that you might have, and you will see on the application that you also submit that back to me as well. So for anyone out there that's interested, we welcome your application. And now I want to introduce Erica McGinley, as I mentioned, from Child Care Aware, who is going to present information on the Child Care Health Consultant Network. So thank you for joining us today, Erica, and welcome.
Thank you so much. And thank you to all of you who've taken potentially your lunch hour today to listen to the presentation. I am here to speak on behalf of the Child Care Health Consultant Network, abbreviated CCHC. We are within Child Care Aware of Kansas. I am one of the consultants for the CCHC network, and our role, we work with childcare providers across the state of Kansas one-on-one on topics that are related to health, safety, and wellness. And as we advance to the next slide, I'll walk you through the different pathways or the different ways that we engage with childcare providers. Pathway A, these providers we've reached out to them and they have let us know that they don't necessarily want to set up specific days and times to work with a consultant, but they would like our consultant's contact information so they can ask a particular question as it arises or request that our consultants send them, a handout or a link to a resource. And the other thing that you'll see within Provider Pathway A is this mention of the peer networking opportunity. We refer to these as our NETS meeting for short. And the way this works, our consultants are spread across the state. And so they're assigned to specific areas. And if a provider's interested in attending a NETS meeting, we connect them to the consultant that is assigned to their region. And the different consultants across Kansas have certain times and days set aside each month to present something to those providers. So the provider logs on It's about an hour-long meeting. And the structure is typically, there's some housekeeping that's done. We discuss opportunities such as a grant opportunity that's being announced within Child Care Aware of Kansas, or any, trainings, educational things that are coming up. And then the consultants usually prepare a slide deck to give some education on a given topic to those providers. There's health observances, of course, that are across the United States. There's a variety of them to choose from. So our team has recently gone through and specified certain health observances that we're going to focus on when we have those NETS meetings. So it could be anything from, oral health to nutrition or physical activity. So they'll do the education portion, and then they open the floor up for questions. So providers have an opportunity to ask consultants questions or to network with each other and talk about successes or challenges that they're having within their programs. In general, at home-based daycare providers have less opportunity to collaborate with peers because they're a staff of one. And so this gives them a space and a platform to be able to run things by peers and network with each other. Provider Pathway B, these providers have told us, we want to schedule specific days and times to meet with you. And initially we were all technology based. So these meetings occurred over Zoom. And in some of the more rural parts of Kansas where the internet connection's not as great, we've done some phone consultations as well, but we like to get that face-to-face interaction so we can establish a connection and a relationship with each other. But now we're excited to announce that in most communities, we are able to do in-person visits. So we do check the CDC COVID-19 community levels to ensure that we're able to safely accommodate that in-person visit. But variety of ways we can meet. The Zoom meetings typically take about 30 minutes. They are scheduled days and times that work well for the provider. So often we'll get the request of the 1 o'clock hour, which is nap time, but some providers say, I'd rather meet, at 6 or 7 p.m. after all the kids have left for the day. Weekends are an option too. So we truly want to cater to meet the needs of providers. And again, those consultation services are all, it's all coaching about health, safety, and wellness related topics. And if a provider is not really sure, in order to kickstart this process, we do have a self-assessment that has 18 questions on it, and it can really help guide us, as far as areas that the provider feels more competent versus areas where they would like to grow within their program. And from there, the providers set their goals, and this is done on their timeline. So we meet with daycare providers as often or as infrequently as they would like for us to. Once they've met those goals, if they would like to go to like a level A participation and just be interacting with the consultants as needed, that's definitely an option. It is provider driven. And then Provider Pathway C, these providers have been referred to us through like a licensing violation through KDHE. The surveyor went and there's something that needs to be corrected within the program. So we will still set goals with these providers and help them implement these things in their program. However, if it's through this pathway that we're connecting, there will be a suspense on that. There's a timeline that we need to follow and a point at which that goal will need to be met. We're also very excited that all of our services are available in Spanish. We have bilingual consultants that can work with daycare providers across Kansas as well. Next slide, please. Within CCHC, or the Child Care Health Consultant Network, we have different tiers. So this is an internal structure that we have set up. The consultants within Tier 1 help providers with startup. So they're there to support potential providers and those who are temporarily licensed. They do engage in community events to help recruit childcare providers and encourage them to get their business up and running. And again, they're providing that support on health and safety related topics. Tier 2, we have consultants that meet with our licensed childcare providers. And again, it's all things health, safety, and wellness related. So a provider could be looking for help with, anything from playground safety to how do I implement oral health in my program, or what types of things do I need to consider with storing medications or household cleaning items, things like that. Really a broad range of topics. And then in Tier 3, this is where I live in the CCHC world. I am the nurse. We are in the process of hiring a second nurse. Interviews are being conducted now. But we have other specialty areas as well. So there's an emergency preparedness consultant, and we also have a health equity consultant. And providers can meet with Tier 3. They come to us directly because we've called and recruited, and there's a provider that specifically wants help in one of these specialty areas, or perhaps they're working with a consultant in Tier 2 and they have some questions that a Tier 2 consultant feels like if they worked with a specialist in Tier 3, they'd really be able to best dive in and answer those specific questions. Next slide, please. I was asked to talk a little bit about myself. So here's a picture of me. I got my bachelor's degree in the science of nursing from Missouri Western State University, which is in my hometown of St. Joseph, Missouri. And I did get a master's degree in public health from Kansas State University. During my Go Griffins, I love it. Yes, that is our mascot at Missouri Western. And I'm very proud for you all knowing that. I started out working with the Fort Riley Health Department when I was working on my master's degree. That was my capstone experience. And so when they had a position open up for a technician, I said, I will take it. I want that public health experience. And so for about a year, I worked in that position, just networking, doing community engagement and helping with their accreditation process. And as soon as they had a vacancy in the nursing position, I applied for it and was hired to be their public health nurse. So I spent 2 years in the clinic, did a variety of things, absolutely loved every minute of it. And one of those roles was to work with the daycares on Fort Riley. So I went in and did the facility inspections and helped assist with the technical portion of training our daycare providers. So I transitioned over to the role of child and youth services nurse, and for a little over 2 years had the opportunity to work with kiddos in 8 different facilities across Fort Riley, ranging in age from 6 weeks to 18 years with a variety of special needs. I am a certified American Heart Association Heart Saver instructor. And as part of my job at the Child and Youth Services position, I taught our daycare providers how to safely administer routine and rescue medications. And I also taught a class on communicable diseases. So we walked through things like how to clean, sanitize, and disinfect, as well as common childhood illnesses. We had pictures, we talked about signs and symptoms, and then vaccine preventable childhood illnesses as well. And I taught a bloodborne pathogen prevention course, and then diabetes care for children in program. Next slide, please. How can I help childcare programs? Specifically, the nurse can work on, and I've done this a lot since I joined the team in January, looking at illness policies. When I came to the team in January, we were in the midst of the Omicron variant of COVID, and providers were really concerned about tightening up those illness policies. What language should I have or could I have in there to clearly communicate? And then also, how do I deliver this message to parents? How do I talk with parents about the exclusion and readmission policy and communicate those boundaries there? Immunization records, I can certainly help providers come up with a system to track that, to make sure that they're reviewing those records at routine intervals to keep those documents current. Also, helping connect to resources. The CDC has some great charts and materials that help explain when vaccines are due, or if that kiddo needs to be on a catch-up schedule, how does that work? Health checks, a daily process that is really helpful for providers to get comfortable with is just a quick visual scan to check for signs and symptoms of illness before that kiddo comes through the door. So if they are experiencing something that could be a symptom that could potentially be an indicator of communicable disease, that is addressed with the parent before drop-off occurs, and that child is, mingling in with the other kiddos in program and potentially spreading illness. We can talk about that with staff as well, doing those just daily wellness checks. And then outbreak mitigation strategies, providers will say, well, we've really been dealing a lot with colds or hand, foot, and mouth, those specific types of things. We can talk and take a look at, well, what's your process? What's your daily process for cleaning, sanitizing, and disinfecting? What's your exclusion process? Let's talk about hand hygiene. So we can kind of work through those critical points where there could be some illness transmission occurring. Child care plans. Kiddos with special needs, there's a variety of things, right? And maybe it's something where you need a memo from like an occupational therapist, that provider does, to give some clarity and some guidance to how to safely and appropriately accommodate that child in care. I can assist with medical terminology if there's language that's not clear, help decipher some of that. Medication administration. Some providers would like to have a policy around this, and so we can help to create that. And then just discuss, the rights of medication administration, how to safely do that, what types of documentation you should have in your program. Bloodborne pathogens. A written procedure, I can certainly help you construct a written procedure to follow for that, as well as determine the contents of a bloodborne spill kit. Poison control, how to safely store those cleaning solutions, any medications. Sometimes when your business is your home, it's hard to look at it from the two perspectives. What would be safe and comfortable for your home setting is not necessarily going to match up with what the requirements are to operate as a business. So we can help look at those things, how to safely secure and store those types of items. Health disparities. I can certainly help providers acknowledge that this exists in communities and help them connect to local resources that may be able to assist families. If a child has a developmental delay, connecting them, plugging them into the community resources that are available there. With oral health, oftentimes I feel like providers minimize the incredible impact that they have on children's lives. Oral health is huge. If you are implementing this in your program, one thing that we can help you do is help you acknowledge and understand the benefit of that and how developing that lifelong good habit carries into health and wellness throughout that child's lifespan. And so informing and educating parents about that type of work that you're doing is really amazing. And it's an important thing that we don't want you to have oversight of. So we can help talk about those benefits for overall health and wellness, how to store like the toothbrushes and the toothpaste, how to prevent contamination during that process, and all those good details. Self-care, super important. People who are in caregiving roles do not tend historically to be so good at this part, but we can definitely work with you to find some activities that work well and are easy, simple, short things you can do to take care of you. Or if you have staff members and you'd like ideas for them, we can help come up with those as well. Child dietary restrictions, plenty of kiddos that have food allergies or food intolerances. I think in the US, it's like 1 in every 13 children actually have a special dietary accommodation. So those providers that would like assistance with substitutions and menu planning and that type of thing, we can help there. Also connecting them in with CACFP or the Child and Adult Food Program. Outdoor safety. So if you've got a playground set up and you're just not quite sure what guidelines you should be following, what adjustments may need to be made, we can certainly make recommendations there, as well as talk about the importance of sunscreen application and bug spray. So we're honoring skin health, and then also preventing some of those communicable diseases that can potentially come from bug bites. And then special health care needs. We really touched on that with the childcare plans, but there are such a wide variety of needs that could be out there, and we're here and ready to assist whatever the circumstance may be. And next slide. We just want to thank you so much for listening to the work that we do. We are very eager and excited to work with childcare providers. We have a passionate team of individuals who are well-rounded, come from a diverse backgrounds, and just so excited to do this work. So thank you for listening to what our organization can do to help.
Thank you, Erica. Does anyone listening in have any questions, whether they're general or specific to your situation that Erica might be able to help answer today? You can either put those in the chat, or you're welcome to come off mute and say it out loud.
Erica, I have so many questions for you. That was amazing. My mind is just going in so many different directions right now. So one of the things that I wanted to ask, and you may not be able to answer it, given that you just came on in January, is, but maybe you can just anecdotally from your colleagues, how has the, I believe it was like tier 3 services or that level of referral, how has that changed the trajectory for providers who need that remedial education and maybe prevent them from getting out of the field altogether? If they've gotten into a situation with KDHE that they've got some deficiencies, because it really feels like having that support would be helpful, but can you kind of tell us a little bit more about those kinds of referrals and how it maybe helps people stay in business?
Yeah, we truthfully, and you're right, I probably don't have the amount of experience that some of the other consultants do in this realm, but since I've come on in January, have not actually worked directly with a level C provider. So one that has come to us because of a licensing violation. I think those are few and far between, to be honest with you. But the tier 3 specialty areas really are, as you described, on the preventive side of things. So we are here to help get things tightened up and structured well for those providers before, a licensing violation would ever occur. But of course, if there was one that happened that was related to those specific specialty areas, we would have, the knowledge base to assist with that. Was there an additional question in there that I didn't address, or anything more that you wanted answered about that subject?
No, I think that covered it. And then just the other thing I was kind of curious about is what are some of the things that providers have been curious about as far as, is there a specific domain that they prefer topics to be delivered on? What have you been doing a lot of?
So we really get everything under the sun. And I wish I could have all of our consultants on here to talk to you, because I know that they could speak, specifically to their areas as well. As far as the nursing realm goes in tier 3, a ton of questions about illness policies. And I feel like I've heard it several times now, providers a little frustrated because parents bring kids who are not 100% well to program, and they want to know how to effectively communicate, those boundaries and those policies to parents, and then make sure that they've got their policies up to date, and containing the most current information so that they can address that head on. Other things, food allergies have come up. I've gone through a variety of different food allergy, how do I edit my menu to accommodate? And then I have co-consulted on emergency preparedness. So it is the season for that, right, here in Kansas, as far as tornado season. But the really cool thing about emergency preparedness is it's not just weather related. So there's such a broad range of topics that maybe providers haven't even thought about with emergency preparedness. And this is anything from what if there's a power outage or a water outage to, active shooter, those types of things. There's just really a wealth of knowledge that our emergency preparedness consultant can share with them on those topics as well.
Erica, I like to, as a former provider and child care center director, when you talk about some of the special health care needs that children come in with and the resources and training that you have available for staff to deal with those effectively. I think that's so important because I know many times that can be very overwhelming and intimidating for the staff to handle. And so can you talk a little bit about that? I know one thing that our center dealt with a lot was the food allergies. And, how do you administer that medication in an emergency, situation?
Sure. And I think another thing that I have heard as somewhat of a common theme is maybe not having the documentation in place that should be there to help guide and navigate that situation. In a center-based setting, that's probably less of a challenge, but in home-based daycare, I really encourage providers that that's not something that you can navigate without a good plan that's signed by that healthcare provider. And when you have a structured document that indicates the foods to omit and those appropriate substitutions, it really clearly spells out, a lot of kiddos, let's say they're allergic to milk. All right, well, is that milk that's baked in, or just they can't drink the fluid cow's milk? And then what sub are we offering in place of that? So those little details where it seems pretty straightforward, but milk is also in a lot of foods that people don't even realize. And so to be able to go through the process of here's how you read labels and here's some common foods that contain those ingredients, it can be very helpful to have somebody from our team, review that with providers, because sometimes it's sneaky how a child could get exposed to that particular allergen. And then coming up with your system, if you have a sub in your daycare for that day, how are you going to ensure that they have the proper training, and how are you going to make sure that that's visible to staff so that they know, where are you going to post that and have it visible so we keep that child safe. Food allergies are a big one. And then those rescue medications, like I said, I used to teach how to administer those. So I have some familiarity with the different styles of EpiPens that are out there. I even have some trainers here that I can use, to show what they look like and that kind of a thing. But yeah, just knowing how to follow those steps and just talking about the importance of practicing and making sure that staff are trained, because when you're in that emergency situation, the anxiety that comes with that often clouds our judgment on how to clearly think about the steps to take. So it's really important to practice that ahead of time, be familiar with that particular child's food allergies, and then how do we walk through step by step that treatment plan to address it if it ever were to occur. Other rescue medications that I'm pretty familiar with, the treatment of epilepsy. Some kiddos have seizure disorders and they have a rescue medication called diazepam. So knowing how to administer that safely. And it can be really intimidating if you are not, you've not experienced that before. A seizure alone can be very scary for those in program, not to mention trying to figure out how to give a rescue medication for it. Also familiar with how to give that rescue medication to a diabetic kiddo that has low blood sugar. So if they need help with that muscular injection of the glucagon, we can help provide guidance on that as well. And then rescue inhalers, a lot of providers, maybe you've had a child in the past that's had an inhaler or something along those lines, but it seems, like I said, it all seems pretty straightforward until you're in the thick of it and you're in that panic mode, and then your line of thinking maybe isn't as clear. So just taking a step back and asking parents too, because a lot of times in my previous position, what we would find is that parents would bring children to care without indicating that their child had a special need. So it's really important to have those conversations to make sure that any special needs that need to be addressed, that you have the documentation in place if an emergency situation were to occur.
Thank you. I like to hear about that parent communication piece, because we did experience situations where we weren't verbally told. We might notice it on the health form, or, just get a medication handed to us and we're like, well, what is this for? So being able to message, that communication with parents and have that dialogue to be able to, position ourselves for success for the child in the facility. So I'm, assuming you can walk them through those processes.
Yes. Yes, how to talk about paperwork, what components should be addressed within that documentation, how to have the conversation with the parent about the importance of it. Because I have been in situations where, the parent may be dismissive of the significance of the child's food allergy or asthma or whatever the situation may be. And those aren't always easy conversations to have, but I think really in general, the best way to address it is head on initially when the parent comes to you for care, and making sure that you're touching on that subject when they interview or come to complete paperwork and go over your program policies, that question's being asked. Does your child have any special needs? And to then go a step further and spell that out, because a lot of times people don't consider an inhaler or a food allergy to be a special need, when in fact, that term is an umbrella term for something like that. So to say, does your child have any dietary restrictions? Do they use an inhaler? Those kinds of questions, it's really important to help spell that out for parents, so it's made clear to them from the beginning that if they have any of those things, you will need, the documentation and the medication to come with them.
Hannah has a question in the chat. What is the best way for providers to connect with a consultant? Can you go through that?
So the contact information slide does have the email address there. You can connect by sending an email there, or if you navigate onto our website, you can also call that phone number and request to be connected with a consultant, and we'll get you contacted and set up for an appointment that way as well. Any of those methods are great.
Well, thank you very much, Erica, for presenting the information and for taking the time to, address some of these additional thoughts and questions so that it's a more clear understanding of what you do. And I think it's fantastic what you do, because this is such a great resource to providers. It wasn't available when I was a provider, and I wish it had been, because it would have been, it's very valuable. So thank you very much.
Absolutely. And also, I just want to encourage providers, we really are here to help. I think sometimes there's the misconception that we will come in and be overly critical, or that we're like spies, for another, entity or something like that. And it's not. It truly is meant to be a support system to childcare providers that have questions. And I think initially when you start up, you may feel pretty confident in that, but as you go through your experience, things are just going to pop up here and there. And we really are here to help address those things and do the heavy lifting, so to speak, if you've got something that you want to learn more about.
Well, it's nice that your program helps people be proactive rather than reactive. So thank you so much.
Thank you.
Moving on to finish out our webinar, just our normal reminders of things that are coming up. The Early Childhood Recommendations Panel meeting, the next one is scheduled for May 20th in the morning from 9 to 11:30. Our next bi-weekly webinar is Wednesday, May 4th. And please always let us know if you have any topics that you're interested in learning about, or if you have information from the work that you're doing to share in the webinars or our weekly emails. The next Children's Cabinet and Stakeholder Group meetings are scheduled for June 3rd, and you can register for that at the link that's being provided. So again, we thank you for joining us today. My takeaway thought for all of you is to make each given day a gift. And that's so important for all of us to remember. And I truly feel like the work that all of you are doing out there is a gift to many people that you provide services and care for. So thank you for everything you do. Thank you for joining us today. And we will see you back here again in 2 weeks. And thank you, Erica. Goodbye, everybody.